Hi friends, I am Dr. Mukesh Sanklecha, Pediatrician and Neonatologist practicing at Bombay Hospital, Mumbai and Colaba for the past 27 years. So basically fever is actually just an elevation of the body temperature. Now when you say elevation, you would ask me what is a normal body temperature? That is actually the most difficult question to answer even after 25 years of practice, because it varies depending on whether the fever is in an adult or a child and where do you measure the temperature. Kids are not cooperative and you need a device which records temperature quickly. So our traditional method of putting a thermometer either in the bum or in the armpit is actually difficult in small children. And you cannot put a thermometer inside the mouth of a small child. So the best way of recording the temperature in a small child is either the ear or the forehead. Both these techniques give you the temperature within 2 to 3 seconds. So one is you can classify it based on how high it is. So if it is very high fever, about 102, 103 degrees Fahrenheit, it is a severe fever. The reason why you classify it as severe or mild fever is because, number one, with severe fever, there is a risk that it may be a serious infection. With severe fever, also there is a risk that a small child who is below 3 to 5 years may actually get a convulsion or a fit. The other way you can classify fever is fever which comes every day, alternate day, or intermittently. So a fever that comes every day is more likely to be a viral or bacterial infection. Whereas a fever which comes, say it comes one day, is not there one day, could be a fever like malaria. It's called intermittent fever. Okay, so the commonest causes are infections, whether it's a viral infection like a running nose, a sore throat, a little bit of vomiting and loose motions, or a bacterial infection like a skin infection, a pneumonia, a gastroenteritis, a urinary infection, or some protozoal infection like amoebiasis, giardiasis, malaria, kala azar. However, there are other causes of fever. A small newborn baby, if he is excessively wrapped, also can have a fever. So in that case, the treatment is just open the baby, unwrap the baby and leave the child open for some time and the fever will come down. The first thing is, should you treat a fever at all? Because fever is actually a protective mechanism. It is an effort by the body to fight the infection by generating heat. So the first principle you must remember is that we must not try and bring down the fever unless it is troublesome or harmful. So therefore, either you would treat a fever only if it is very high or it is typically troubling the child. So when a mother asks me, should I treat the fever? My question to her is always, is it troubling the child? Sometimes the fever of 99 or a very low fever troubles the child because the child becomes cranky, irritable, or very quiet and dull and inactive. Then you must treat that fever. If the fever is very high or little high, but the child is active, playful, comfortable, eating well, you may as well wait and watch. The home remedies available to treat fever is obviously one is medical. Most mothers have a syrup, paracetamol at home, which can be administered for a few days pretty easily and harmlessly. The other intervention that a lot of mothers do is tepid sponging. That is, they use sponging on the forehead, on the chest, on the extremities, upper arms, lower arms to bring the fever down. With tepid sponging, it is important that you must not use cold water. If you use cold water, the baby shivers and the fever goes up again. So tepid sponging should be with tap water and never with cold water. There is a constant problem that mothers complain of all the time. So what do? My child is not eating. So I ask the mother, do you eat when you are unwell? Even you stop eating, so the child is also going to stop eating. And there is enough source of food and nutrition in the body for the child to survive on stocks that are already there in the body. At the same time, there are some tricks. You must try and first give a fever medicine, bring the fever down. When the fever is very high, the child will refuse foods and water and fluids and will vomit if you force her. At the same time, if you bring the fever down with medication, once the fever is down, that is the window period where you can push in a little bit of food and a little bit of fluids. When fever goes up, the child tends to lose a lot of fluids from the body. It's called insensible water loss. Typically, it's like if you pour water on a hot plate, the water flies off. Same way water flies off from the body. So it's very critical that you ensure adequate fluids going in, adequate hydration, so the child remains well. And the trick is to give foods in small alikos. If a normal child eats 4 chapatis or 2 chapatis, don't expect him to eat his full diet. Even if half a chapati goes in during sickness, it's a bonus. So when do you seek medical opinion in a child with fever? Almost never in the first few days, because any fever, once it starts, is going to go on for 2, 3, 4 days, even up to 5 days. So if the fever goes on beyond a few days, if after 3, 4 days the fever is still high, if the child is sick and unwell looking, dull, inactive, not taking fluids, or has some other symptom, he is going on vomiting, he has very bad cough, when he cries when passing urine, he has bad loose motions, then obviously you may need to treat that symptom along with fever. But otherwise, if the child is active, playful, his intake is reasonably okay, he's playful once the fever comes down, you can easily wait for 3 to 5 days and not go to the doctor in a hurry.